Have you ever been told you have a tight QL, that muscle right onto the side, the low back? In this video, I'm gonna show you a couple things you can do for this. What's going on? My name is Dr. Nick Bonforte, physical therapist. So QL tightness. Now, to better understand this, we have to think about where the QL is. The QL is called the quadratus lumborum, and that muscle originates on the iliac crest, and then it goes up and attaches to some ribs. Now, what it's responsible for doing is side bending the body to one side. Now, a lot of times when we have low back issues or pain, this muscle can be in a spasm or it can tighten up from a protective mechanism. But if you've been dealing with this tightness for a very, very long time, you might have to think about some other things. There's another side of this, is that if something is always tight, it's tight because it's lacking strength. So it tightens up because it can't tolerate different ranges of motion and things like that. So by addressing a strength issue, we could actually make some gains on lowering the stiffness and the tightness you potentially might be feeling. So this exercise is side bend eccentrics. Why is this important? Because as we know in the beginning, the QL muscle attaches from the iliac crest to the ribs, and it side bends us to the same side. So with this exercise, we're gonna go the opposite way with some weight, which is gonna be putting the muscle through a lengthening position, adapting more strength into a range of motion or throughout a range of motion. So with this one, we're setting up, I'm letting the weight drop my body to the side, and I feel all of the side muscles stretching. Now, I'm not just going straight down quick, I'm letting the weight pull me down, but I'm using this side of my body to control it. And then I come back up. So I go down, nice and slow, feeling the side of my body working, and then I come back up. And I would just be repeating this. Now, depending on the weight, you'll obviously get more of an input into this region. Now, are we only working the QL muscle here? Of course not, but we're trying to help bias that region to then help with the strength to this muscle. This exercise is a simple side plank, and what we're gonna be doing is addressing the side of the body. So if we're thinking of working on the right QL, it's right now on a stretch because the right QL side bends my body to the right side. I'm in a little bit of a left side bend given this position. As I go up into a side plank, I'm putting my hips in a neutral position, which helps isometrically work that region of the body, or try to bias that region. Are we just hitting the QL? No, there's other muscles that are getting hit, but we're trying to bias that region. So I'm gonna have my knees bent just for demo purposes, but the knees can be straight out to the side, or straight, and you could be in this position. So knees are bent just for demo, and I go up, and now right here, my hips are even, and I'm kind of straight. So if I were to stand up, I would be straight. And that I feel obviously my side on. And what this is doing is help biasing isometrically that region of the body. And I would come down. So the isometric could be 10 seconds, 30 seconds, a minute, whatever's doable for you or most beneficial for you. But the concept of addressing this is the main thing with this one. So we're going up, holding it, and then coming back down, again, addressing it from an isometric standpoint. So hopefully these exercises give you some insight on things that you can start to do and address this region of the body to make some gains in maybe the things you might be experiencing to that QL muscle. Hey, before you go, if you found value in this video, I would really appreciate it if you support my channel by subscribing down below, liking this video, and don't forget to turn on your post notifications so you never miss a video from me. This is Dr. Nick. I'll see you next time.